speak about a structure, a very amazing organ that the position is inside of the thoracic cavity. There is a position inside of the thoracic cavity. You know the costal cartilage, you know the muscle, the bone, all of the bone are going to protect from all of the content, all of the organ inside of the thorax. We have one part, and normally when I'm going to stand in normal anatomical position, the heart is such as my hand. 2/3 of the heart is in the left side, 1/3 is in the right side. If I want to explain for you the direction, the position of the heart, imagine I rotate my head around 45 degrees to the left side. It's going to remember you the position of the heart. It is normal. Sometimes in some of the person in congenital disease, it's possible the heart directed right side. But normally it's in the left side. Now, heart has apex and the base. Base is anterior to vertebral column, posteriorly in the right side. Apex is anteriorly, downward, forward. Okay? So the apex of the heart is forward, downward. The apex of the heart is inside of the left fifth intercostal space. Which intercostal space? Fifth. In the right or in the left normally? Left. So the apex of the heart directed forward, downward in the left side. Apex is going to be found in which intercostal space? Fifth intercostal space. Now look at to me, the fifth intercostal space is going to begin near the sternum and it is going to continue to the vertebral column. In which part? The base, the apex is above 8 to 9 centimeters far from the sternum. Not 2 centimeters, not 11 centimeters. Above 8 to 9 centimeters. You go far from the sternum in fixed intercostal space in left side, you can find the position of the apex. Okay? So I'm sure if I ask you, draw the heart, it is possible to make mistake. If you want to draw the heart, it is possible you draw such as this. Yes? Such as this. Yes? Perhaps this. Okay. Now, but it is not correct. It is incorrect. The heart in our body is, the position is oblique. The apex is backward and right side. The base is backward and right side, and the apex is downward and forward to the left side. It consists of 4 chambers. It consists of 4 chambers. Right atrium, right ventricle. Left atrium, left ventricle. We have a septum, a valve that divides the right atrium from the left atrium. A septum, a valve that divides the left ventricle from the right ventricle. Do you know this? Yes. Now, around the heart, we have a covering sheet. This covering sheet we call pericardium. Pericardium. The covering sheet of the heart we call pericardium. To be able to access to the heart, we should cut and remove the pericardium. The heart is going to beat inside of a sheet. The name of this sheet is pericardium. Okay? The heart is going to beat inside of the pericardium. Sometimes you have inflammation above this pericardium. And sometimes you have problem with the myocard, with the muscle, with the artery, with the vessel of the heart. The signs are different. About this picture, if you notice, we have a colon section. We remove the anterior wall of the thorax. And also, in this picture, I'm going to remove both lung, left lung and right lung. I remove laterally to be able to show you the position of the heart. Also, I remove the cover sheet of the heart, the peripheral, to be able to show you the heart, the core. Here is apex in the left side, and the base is back in the right side. Right atrium, right ventricle. Left atrium, left ventricle. If you notice, inside of the chest, inside of the thorax cavity, we have in each side right line, left line. Both of them are going to cover the heart. And both line and the heart are going to protect by the bone, muscle, cartilage. Okay? Between all of this structure, the best position belongs to the heart, inside of a very high and very strong structure, bony, cartilaginous, muscular structure, and also both lines are going to cover and protect them. You can imagine in the airport, in the airplane, you have the first class. It is the better part. It is the first class in the thorax cavity for the heart, belong to the heart. Now, there is the position of the heart in the central part of the thorax cavity. Now, according to this explanation, look at this picture. It is a sagittal section of the thorax cavity. It is dome shape of the diaphragm, and it is superior opening or inlet of the thorax. Okay? This sagittal section, in each side, belong a space that belongs to the left and right lung. And in the central part, we have a quadrangular space. This quadrangular space we call mediastinum. Between right and left lung, inside of the thorax cavity, we have a quadrangular space in the central. What's the name of this quadrangular space? Mediastinum. Look at the mediastinum. Mediastinum floor is going to be bonded by the diaphragm. And the mediastinum superior is going to be bonded to the superior opening of the thorax. Imagine inside of the mediastinum we have heart. Now, if I pass a plan that anteriorly pass from the external angle horizontally, this horizontal plan posteriorly is going to pass from intervertebral disc between T4 and T5. Imagine, it is not real plan. Imagine a horizontal, a transverse plan will pass from the external angle anteriorly. This horizontal plan posteriorly is passed from intervertebral disc between which thoracic vertebra, T4 and T5. With this horizontal and imaginary plan, we can divide the mediastinum to two small areas, to two small chambers, superior mediastinum, inferior mediastinum. Where is the heart? Inside of the superior mediastinum or inferior mediastinum? Inferior mediastinum. Now, look at the inferior mediastinum. Anterior to the pericard, posterior to the sternum, I am able to show you a narrow and a small area we can call anterior mediastinum. And posterior to the heart and the pericardium, anterior to the thoracic vertebra, we have another space, what we can call posterior mediastinum. Between anterior mediastinum, posterior mediastinum, we have pericard and the heart. Here we can call middle mediastinum. Where is the position of the heart inside of the middle mediastinum? Now you know middle mediastinum is listed in inferior mediastinum. and the great vessel. Okay? Now, how we can prepare for you question, or how we can explain for you some case that belong to the mediastinum. For example, you know that here is superior mediastinum. If you have a inflammation of some of the lymphatic node here, okay, they are going to compress some of the organs, some of the structure that are passing here and make problem for them. It is important. Or after some class, something I explain for you, I explain for you. The esophagus. Where is esophagus? What is esophagus? Pharynx connect to the stomach. The esophagus is going to begin in the semipharyngeal, coming down, enter to the superior mediastinum, and continue go to the posterior mediastinum. So it is possible in the exam I ask you which of the following element, following organ are visible in superior mediastinum and posterior mediastinum too. You can remember. I'm going to speak about the tenth cranial nerve, vagus nerve. Accessory nerve is 11th cranial nerve.
Yes.
What is the name of the tenth cranial nerve?
Vagus.
Why? It is important. Do you know why? Because it is the longest cranial nerve in our body. All of the 12 cranial nerves are coming, arising from the brain. Most of them are going to distribute, to spread in the face, in the skull, in the neck. Only the vagus nerve leave the skull, coming, enter to the cervix, enter to the thorax, passing through the diaphragm, enter to the abdomen. It is the longest cranial nerve. What's which nerve? Hands. What's the name of hands? Vagus nerve. Never forget. The vagus nerve in right and left side, both sides, they are passing through the superior mediastinum, enter to the posterior mediastinum. So, in surgery, operation, in anatomy, in the clinical case, always remember all of the structures that are passing from the thorax. I think this is really important. One of the organs that belong to lymphatic system, and it is visible inside of the superior mediastinum, we call, posterior manubrium, thymus. Have you ever heard thymus?
Yes.
Thymus, the position is inside of the superior mediastinum, and thymus in the baby is large. It is going to get larger until the puberty. After that, it is going to get smaller, okay? And it is going to degenerate. So in adult, normally, when we open and look at the superior mediastinum, we are not able to show you the thymus because it is going to get degenerate, smaller. Of course, in some of the race, it is possible in all the time of the life, it remains large. It depends. But commonly, it is going to get degenerate. Now, thymus is one of the content of superior mediastinum. In baby, it is large. If it is large, it is coming to enter to anterior mediastinum. Okay? So, continuation of the thymus is visible in anterior mediastinum. Now, we come here. It is, we remove the anterior wall of the thorax, but we never remove the line. Look at the heart, and coverage of the heart is white sheet. Are you able to look at the heart completely?
No.
It's hard because the line and the coverage of the line are going to cover the heart. If I want to show you the heart, I should remove laterally this. We remove the right and left line, so I am able to show you the pericard, and inside of the pericard, I am able to show you the heart. Look at of the diaphragm is going to get black. So the pericard is coming down, okay? And the position and the shape of the heart is going to change. Come down and go up. Come down and then go up, okay? So the pericard, never forget, inferior pericard has connection to superior surface of the diaphragm. You know, the superior surface of the diaphragm is floor of the thorax cavity. The inferior surface of the diaphragm is roof of the abdominal cavity. Now, pericard is visible here. In each side of the pericard, you are able to look at the nerve. In atlas of the anatomy, when we are going to show you the nerve, commonly, usually we use from the yellow color. It is the nerve that we call right phrenic nerve, left phrenic nerve. Right phrenic nerve, left phrenic nerve. Never forget. Phrenic nerve is going to fall by three cervical spinal nerve. T3, C4, C5. All of the fiber that belong to C4 means the fourth cervical spinal nerve. Some of the fiber from C3, some of the fiber from C5. All of them join together and make the phrenic nerve. Phrenic nerve is responsible to innervate the diaphragm. It is responsible to innervate the diaphragm. When they are coming down, they are going to innervate the pericard, innervate the pleural too. So it is the right phrenic, left phrenic, when they are coming down to innervate the diaphragm, they have some branch to innervate the pericard, some branch to innervate the pleural. What is the pleural? Pleural is the partnership of the line. What's the name of partnership of the heart? We call it pericard. Both of them are going to be innervated by the phrenic nerve. Look at the pericard. If I want to show you this vein, the name of this vein is vena cava superior. If I want to show you vena cava superior, I should cut and remove the pericard. Means some part of the vena cava superior is inside of the pericard. And some part is visible here also. When I am going to show you the ascending aorta, some part of this ascending aorta is inside of the pericard. So if I remove the pericard, I will be able to show you all length of vena cava superior, all length of the ascending aorta. Now, look at the pericard. This pericard, outer layer of the pericard we call fibrous pericard. Fibrous pericard. What's the name of the outer layer of the pericard?
Fibrous
pericard. The phrenic nerve, right side and left side, are responsible to innervate the fibrous pericard. Now imagine, here we have fibrous pericard. Here we have fibrous pericard. This fibrous pericard is outer layer. Inner to the fibrous pericard, we have serous pericard. This serous pericard consists of two layers, parietal and visceral. Parietal and visceral. Again, pericard consists of two layers, fibrous, serous. Fibrous is outer layer. Serous layer is inner layer. Serous consists of two layers, parietal, visceral. Which of these two layers is near the fibrous pericard? Parietal. Which of these two layers is near the heart?
Visceral.
Now look at this picture. It's going to explain for you. If you notice to this picture, here we are going to show you the blue line. This blue line is going to remember you fibrous pericard. And the serous pericard is between the parietal serous and visceral serous. We call pericardial cavity this black color. Inside of the pericardial cavity, the heart during the systole and diastole is going to beat. And between the parietal serous, visceral serous, inside of this space, we have a small, a few amount of the liquid. This liquid decrease the friction and help to the
heart.
function, right business. Sometimes, in some of the problem, it is possible inside of the pericardium, we have accumulation of the liquid. This liquid can be blood, can be lymph, can be pus. This extra fluid, anything, inside of the pericardial cavity is going to compress the heart and prevent the heart to be able to dilate it completely during the diastole and during the systole. This compression, because of accumulation of the extra fluid, make a problem for the function of the heart. Accumulation of extra fluid we call effusion of the pericardium. We call effusion of the pericardium. And this effusion of the pericardium in pathological time, accumulation of the liquid, we call effusion of the pericardium. This effusion leads to decrease and prevent the normal function of the heart. This accumulation we call effusion of the pericardium. This accumulation we call effusion of the pericardium. And effusion of the pericardium can lead to bad functional of the heart that we call tamponade. Tamponade is because of the effusion of the pericardium. Look at here, around the heart, here, around the heart, you have accumulation of the liquid, and it is bad. It is not normal. It is going to compress the heart. This accumulation of the liquid is going to lead to bad functional of the heart that we can call tamponade. We can call tamponade of the pericardium. So tamponade pericardium means tamponade pericardium is bad functional of the heart. What is the reason of the tamponade? Effusion. Never. Now I come back here. Look at here. So this blue color is going to remember you fibrous pericardium. This red color is going to remember you serous pericardium. Serous pericardium consists of two layers. Parietal layer, visceral layer. The visceral layer attached to the heart, and you are not able to separate from the heart. In histology, you read about the heart consists of three layers: endocardium, myocardium, epicardium. In histology, epicardium in anatomy we call visceral serous pericardium. In histology, you call epicardium. And between the pericard fibrous and parietal layer of the pericardium, these two connect to each other, attach to each other, and you are not able to separate. Means if you come to the dissection room, I will show you the pericard. Imagine, here is the pericard, okay, and heart is here. I told you the outer layer is fibrous pericardium. Heart and tell you that the inner layer of this layer here we call parietal serous. Normally I am going to show you one layer, but histologically externally and inner layer are different. Externally we have, outer we have fibrous pericardium, and inner layer we have serous parietal pericardium. Then I remove and show you the heart. Explain for you the outer layer of the heart that I am not able to separate we call visceral serous pericardium. Now, this layer consists of two layers. Tell me the name. Fibrous pericardium, serous layer. Both of them are going to innervate the same. What about the visceral pericardium? Visceral serous. It is going to innervate such as the heart, sympathetic and parasympathetic. Now you are at exam. I'm going to ask you. The phrenic nerve is going to innervate all of the inferior items except fibrous pericardium,
Yes.
Yes.
serous pericardium, diaphragm, serous visceral pericardium. No, it is going to innervate by sympathetic and parasympathetic, not by the phrenic nerve. Now, if your patient comes to your office and explain to you, I have pain here, but this pain is positional, then I am going to lying, this pain increase, but then I am going to sitting and come a little forward, it is going to decrease. You should be, of course it is not the exact sign, but it is positional. You can think about the pericarditis, this inflammation of the pericardium. The inflammation of the pericardium is positional. In some position, the pain decrease, in some position, the pain increase. But sometimes your patient said to you, then I am going to running, or I am going up a stair very fast, I have pain. Then I am going to resting, I never have pain. I never have pain. Means that here you should remember you have problem with the vessel of the heart. The vessel of the heart, the lumen is in this patient is going to get narrower because of lipid, bad nutrition. Okay? When you are going to do you have rest or you are going to slowly walking, nothing happens. Then you are walking, the heart needs more oxygen. But this lumen is so narrow and is not able to prepare for you enough oxygen, so you have pain. When you rest, the pain will stop here. Now, what is difference between the MI and pectoral angina? MI and pectoral angina. The MI means myocardial infarction. Myocardial infarction. In myocardial infarction, the pain of your patient continuously is visible and never stop. Never with the rest, with the position stop. In MI, you should do something. Emergency, you should do something. It is MI. In the angina of the pectoral, no, it is not. If you are rest, the pain disappears. When you are going to do something very fast, it is going to happen. Now, look at this picture. Here, we remove the pericardium, so I am able to show you vena cava superior. Look at here. Inferior part of vena cava inferior is inside of the pericardium. Superior part is outside. Look at the pulmonary artery. Look at the aorta. Some part of this vessel are inside of the pericardium. If you buy the part of the sheep or cow, or some of the persons that are not vegetarian, you can buy the part of the cow and sheep at the first, dissect, look at everything, and read the anatomy. After that, you make kebab and eat. Okay? It is a best way to understand. Then we are going to look at the heart. Outer layer of the heart, we have some groove, some circles. For example, we have a groove that circular the heart and divide both atrium from both ventricle. And annually, I am able to show you another groove. Another and it is the heart. It is diaphragm and it is the heart. In my body, the heart is resting over the diaphragm in one surface. It is anterior surface, inferior surface, left surface, right surface. Anterior surface, inferior surface, right surface. Which surface resting over the diaphragm? You can call diaphragmatic surface. So we can call inferior surface or diaphragmatic surface. And the last thing you should know, the base of the heart is backward one side. When you are going to standing, the base of the heart is anterior to T6 to T9 when you are standing. When you are going to lying supine to supine, yes?
Yes.
Do you know the supine at home? When you lie in the back on your bed, it is supine. When I'm going to do the injection in the glucose surface, you should prone lie, such as this. This is supine. When you are going to resting, the position of the diaphragm change a little come up. So the position of the heart change. When I'm going to standing a little, the heart come down. So when I'm going to standing, the base of the heart is anterior to T6, T7, T8, T9. When I'm going to resting,
T4?
no, T5. 1.
T5.
When I'm going to resting supine, is changed to T5 to T8. Because a little go up. Can you imagine? T9 change to T8, T6 change to T5. A little go up. When I'm resting supine. When I'm standing, it is coming down. And it was one of the questions in the last semester. Okay? Okay. Today it is enough. You can go home and rest. But please read carefully the next session. If the God help, when I am here, I'm going to finish all the things about the cardiovascular anatomy system. Please read carefully. Never accumulate all of the subject for the final exam. Anatomy is not a lesson that 1 week before the exam you read and you see you can pass. I love all of it, but good mark. But unfortunately,